All right. Good afternoon, Greyshirt Nation. Welcome to your Greyshirt chat on Friday, May 8th, 2020. Stories from the field. I think it's safe to say the last few months have been pretty monumental for this organization. In January, late January, early February, we were mapping out training goals, preparing for a massive storm season, mitigation, recovery, operations across the country. That all radically changed in late February, early March, when a global pandemic swept through the United States and kind of altered the course of this organization and our service deliveries. We went from helping communities prepare for disasters to filling gaps in services with some of our partners that primarily relied on will become vulnerable populations to deliver those services. Everything from food delivery, shelter support. We even flexed into testing, mobile testing for COVID, and field medical services in California, and supporting the Navajo Nation in Arizona. Just a truly monumental effort by Greyshirts across this country to help those in need in one of the most challenging environments we've ever worked in. Today we've collected some stories from around the country from those different services to help really just illustrate the hard work that everybody in this organization has been doing over the last few weeks. So with that, I'm going to turn it over to Mike Watkins, who's co-hosting this with me, and we'll run through some quick introductions and then get into the stories. So welcome to Stories from the Field. Over to you, Mike.
Hey, good afternoon, Greyshirts, and thanks for dialing in. More than 5,000 Greyshirts have been engaged in the last 6 weeks, so we're looking to continue that and being safe as we do that in our responses. Again, Mike Watkins, Director of the Midwest Territory. I've been supporting Zachary Brooks Miller and the National Operations Center with our high-risk tempo operations going forward. With that, we'll just continue and get through all our introductions, and then we'll circle back to the stories from the field. So I'll hand it over to Corey next.
Hey, afternoon, everybody. Corey Ide. I head up our capabilities development team, and in this COVID context, have the opportunity to facilitate our future operations task force.
Then we'll just go right through. Larissa.
Hi, I'm Larissa Murray. I am the Geographic Associate in the Northwest Territory, specifically overseeing Washington, Oregon, and Alaska.
Awesome, thanks. Vicky, you want to introduce yourself?
Hi, I'm Vicky Vega. I'm a new Team Rubicon member. This is my first deployment, so I don't actually have a position. I move wherever you need me.
Awesome, thanks, Vicky. Ian, over to you.
Hi, my name's Ian Cobbs. I'm currently a task force leader in Detroit for Kick the King.
And Dr. Bradley.
Dr. Bradley. I was recently deployed at Kayenta, and I also oversaw the Team Rubicon operations here in North Carolina.
All right, and now we'll just jump right into the stories from the field and some of the projects that we're working on. Really, this next project is the culmination of several projects kind of coming together. We have all these plans that we had at the beginning of the year, and some of them went out over the next couple of years. But however, much like jumping into the arena, we like to expedite things whenever we can, and that's the culmination of this next topic. So, Emergency Food Assistance Program, and this is going to be brought to us by Mr. Corey Ide. Corey, please.
Yeah, hey, thanks, Mike. Hey, folks, it's really a treat and a pleasure to be able to talk with you all today. It's a pretty monumental day for the whole world, as we're still, every day is a new day facing COVID-19. That said, it's a pretty monumental day for TR. Today launches what is externally being referred to as our Emergency Food Assistance Program. And I want to give you just a couple of details on how this is going to help folks affected by COVID-19 and have some really unique medical vulnerabilities. I want to give you a little bit of background, and then I want to share with you the process. And then I'm going to hand it over to Larissa to dive into how you directly have the opportunity to engage here. So every single one of us, more than likely, has had a family member or a friend who's experienced cancer, multiple sclerosis, or rheumatoid arthritis. today, TR's got a unique way in which we're going to be able to help individuals that are experiencing one of those ailments and has been uniquely affected by COVID-19. Bristol Meyer Squibb Foundation came to us a number of weeks ago and had been watching the Neighbors Helping Neighbors initiative that we had launched literally just weeks ago. They were impressed with what they had seen, and they had been fielding requests from some of their partner organizations that assist individuals experiencing cancer, rheumatoid arthritis, or multiple sclerosis. And these other partner organizations had indicated that many of those individuals were no longer able to access their location of food and meals as a result of COVID-19. These folks are immunocompromised, and so the ability for them to access those food sources or dramatically increase the risk to them as they're navigating those medical ailments. And so Bristol Meyer Squibb Foundation came to us and said, hey, do you think Team Rubicon could assist and really mobilize the TR Nation to help pick up and deliver food to these individuals in need? After a little bit of conversation and a little bit more research, we identified that, hey, obviously we could do that, but as we dug a little bit deeper, we found out that one of the key things that these individuals were experiencing was actually the financial impacts of COVID-19. As many of us know, 33 million people have hit the unemployment rolls just in the last few weeks. And so not only are these folks dealing with an immunocompromised state, many of them, whether it's themselves or directly their family members, have been financially affected by this as well. And so as a result of this, we saw this as an opportunity not only to solve for emergency food assistance, but also to partner with another organization called the Patient Advocate Foundation. Patient Advocate Foundation provides financial assistance and case management services to a lot of individuals dealing with these medical conditions around the country already. And so what we quickly realized over just a little bit of exploration was that between these three organizations, we could really have a disproportionate impact on folks that are experiencing something truly, just really truly significant, dealing with this challenge of a medical condition and dealing with COVID-19. And so we see these three partners coming together as the next iteration of the Neighbors Helping Neighbors initiative, which just kicked off a few weeks ago. What this looks like today is that this is going to be, so I'll talk about the process for a minute. What this looks like now is that this is going to be an asymmetrical and as automated of an opportunity for all of us to assist our neighbors, and specifically these neighbors with cancer, rheumatoid arthritis, or multiple sclerosis. These three groups have come together. You can now take a look at the Neighbors Helping Neighbors webpage at trusa.org/neighbors. You can see that we have overhauled that page as a call to action now to help these individuals. And simultaneously, if you were to go to teamrubiconusa.org/apply now, you now will see an intake process for any of these individuals or a family member or a patient advocate that's supporting one of these individuals to go ahead and apply for assistance on Team Rubicon's website. So Team Rubicon is going to serve as the initial intake for any of these individuals with these medical conditions and have been financially affected by COVID-19. And really what this now does is clients will be able to fill out a little bit of information about themselves, whether they need emergency food pickup and delivery assistance, which TR Greyshirts are going to mobilize across the country to assist with, whether they only to automatically provide that information to Patient Advocate Foundation. And Patient Advocate Foundation is going to be able to send them financial assistance in a period of 3 to 5 days for them to solve for their own needs on their own if they so choose. Or there's really kind of a third option here, which is an individual asking for not only financial assistance, but also that pickup and food delivery. A neighbor asking for assistance, and we can raise our hand to meet that neighbor's needs where they're at. Larissa Murray, over to you.
Thanks, Corey. Hey, everyone. I'm really excited to be on this call today, talking with you all about how you can get involved in answering these requests for assistance through this emergency food assistance program. So as Corey said, this initiative is similar to our Neighbors Helping Neighbors campaign in that there's no traditional operational planning and mobilization associated with it. So you won't be getting dispatch instructions to go perform these acts of service. This is just each one of us as individuals, as gray shirts, going out there and performing this necessary function for those folks that are unable to, given the current situation. So that being said, you all should have received an email today telling you about the exciting launch of this partnership and this initiative. As a follow-up to that, you probably have a few questions, and hopefully what I'm about to cover will answer those questions for you. If not, please go ahead, put them in the Q&A window, and we'll either answer them there or we'll get to them at the end. Your first question as an awesome and motivated gray shirt is probably, how do I go out there and get shit done? And that is a great question. So these requests are going to be displayed on a map in roll call. If you see one in your area, you'll go ahead and click on it to read more about it, more about what's required in that specific service. And if you find that you can perform that service, then you confirm your commitment by clicking a button. Once you accept that request, you'll see information displayed for contacting the client that has requested assistance, and you'll be contacting them directly. And it'll also tell you the best time to contact that person. Like Neighbors Helping Neighbors, it's on you to coordinate with the client to figure out where, when, and how to perform the service. To help you as you start to navigate this new program, we did develop a job aid, a frequently asked questions sheet, and a website that you can go to read all about how the process works. The job aid also goes into much more detail about coordinating with the client, questions you should be asking, and additional language and narrative that you might find helpful in working through the process and in talking with that person. Once you've completed this active service, you go back to that same page in roll call where each request for assistance that you've committed to answering, you'll see listed at the bottom of the page. From there, you click on that particular service, and then you verify that you've completed that service. And here again, it's similar to Neighbors Helping Neighbors in that you're entering details about how long it took, a description of the service that you performed, the date of completion, and then you save it and close out, and voila, you are finished with that specific act of service. There's no limit to the number of acts that you can commit to, but we definitely ask that you just keep in mind that we are trying to serve these folks as quickly as possible. So if you're unable to perform a task in a timely manner, please allow other gray shirts in the area to sign up for that opportunity to serve as well. Due to current safety guidelines and restrictions, those gray shirts that are over 65 years of age are unable to participate in this initiative at this time. There are, however, opportunities for getting involved remotely. So please get in touch with your local administrator to find out exactly what those opportunities are, because we know you want to continue to serve and we want to help you do that. Throughout the initial rollout, I'd ask that you all just remain flexible and patient as we continue to improve the system and update the resources that are available to you, like the job aid and the frequently asked questions sheet. Again, really excited to see you all continue to get out in the field, continue to serve, and continue to have such an awesome impact on your communities and for those individuals that need it most at this time. That's it from me. Thank you all for all you do.
Hey, a couple of quick follow-up questions for either you, Corey, or Larissa. How many engagements do you think we'll have coming out of this endeavor? Do we have an estimate yet, or is it still to be determined?
It's still to be determined. I can tell you within the first hour, we had 20 requests for assistance come in. And as this starts to get communicated across those partner organizations and their networks, we can only anticipate the demand to grow.
No, that's awesome. Have we thought or considered anything about volunteers taking pictures while they're out there and what they should do with those, or is that on the fact sheet?
Yeah, I think Larissa, if you and I want to take a quick review real quick to make sure we're answering that as accurately as possible, we can take a minute to double check that, Mike, and then you can pick us up again in a minute.
Awesome. No, and sorry to throw a curveball at you. That was just something I was thinking about while you guys were talking.
That's a great question.
No, the next story from the field that we'll transition to, and we'll circle back to all questions here at the end. Unless Zach, did you have any before I transition?
Yeah, Corey, I had an additional question. I think it's safe to say anything Team Rubicon puts on its 3 to 5 year plan actually happens in 6 to 12 months. Rebuild, emergency medicine operations in complex environments are just some examples of the past few years. This partnership with BMSF seems to be an extension of our client services. And how does this set us up or set the organization up for future success?
Yeah. I mean, really, folks, what this creates the opportunity to do is dramatically jump ahead, right? And when I say jump ahead, as you all know, for core operations, more often than not, we go out looking for people to assist. And we've never really historically had a holistic solution to creating a space for people to ask Team Rubicon for assistance. And so, as we'll see, this creates an immediate opportunity to help these individuals in this COVID environment. What it's creating, though, is the foundation and the platform for us to grow pretty dramatically over the coming months, and what maybe would have been 3 years, which will now probably be like a year, to really expand this so that folks experiencing hurricanes coming this summer, we may have the opportunity to incorporate this strategy and this kind of strategy in as soon as that. Timeline still to be determined. Our 100% focus right now is this collaboration on emergency food assistance. But the long-term game is creating as many opportunities for people that experience disasters to reach back to TR and ask for direct assistance. And then just really quickly to put a bow on it, back to your first question, Mike, 100% Greyshirts that are out carrying out acts of service through this initiative, 100% take a photo of that, share that through your networks, as long as you are practicing our safety protocols, as long as you're being mindful of your safety, others' safety, and do not stand next to a patient and take a photo for them. Keep that six feet of distance. If they offer to take a photo with you, you better damn well have brought a tripod to be able to set that up so you can stand 6 to 12 feet away from them to make sure everyone's safe.
No, thanks for that, Corey. We'll transition into the next story coming right to the field out in California. Over the last 6 weeks, we've really extended testing from North Carolina all the way to California and a few spots in between. We're teaming up with really what is proving to be one of the best in practice organizations by the name of Verily. They're a research organization devoted to really the study of life sciences, but they focus on healthcare and biotechnology. I helped the team out in the Southwest stand up this first pilot with Verily at the testing site in Los Angeles. They've teamed up with the California Governor's Office as well as local public health authorities. And what they're doing is they're trying to provide a system where people can sign up and be tested within 48 hours. And the testing is really taking it to the next level, as far as we've been able to rotate people through these teams within about 5 minutes of show up, check in, check out, and be on their way, compared to some of the other local agencies where if you go to your local clinic, they might only be able to see 4 or 5 people a day. Same with their testing, only be able to see or get through those tests and verify them with 4 or 5 per day. They're rotating upwards of 200 people per site across the other locations that they're at. We're looking to expand this. So now for stories directly from Los Angeles, we'll hand it over to Vicky. And can you tell us a little bit about what's going on out there and how you're doing?
Hi, I'm Vicky Vega. I'm glad to be here. I am new to Team Rubicon. Can you hear me? I'm new to Team Rubicon, and this is my first deployment. So it's pretty exciting. I've been waiting, and this is a COVID testing site. Was slow to go. Monday we had our soft open. We saw about 25, a little bit more patients. Next day it doubled. Wednesday it was a little bit more. Now we're up to, today we're 306 patients. So it's due to double for Monday at least. So it's been pretty fluid. We've set up, I mean, that's one thing about Team Rubicon. You always try and fix something, you know, if you can do something better. So the patients come in at the entrance, they're checked there, guided through. We now have three lanes coming in of patients since we have so many. We don't want them to wait very long. Like I said, it's pretty hot out here. So we want to get them through as quickly as possible and as safely as possible. They come to the site where we do the admin. They do their first ID check. They check the ID, we do all the paperwork, and then they run them through. They get the COVID testing, and then they're off. But we have 2 sites that check, verify ID, and they have an appointment. A lot of the people that are coming up ask if they can come here because the other testing sites have such long lines. So I think word of mouth is getting out, and they're starting to come out. It's a very fluid thing. If something happens, and we move on to something new. So we adapt. And I like that. I mean, it's a team and everybody works together. I think that's what's really important. Any questions?
I'm sure we'll have a lot more questions coming in at the end, but also supporting Vicky out there in the Southwest, the leadership team with Aaron O'Rourke and Lorraine Reiser being the task force leader on the ground. Like, a big hats off, that team was able to spool up this site in about 72 hours. And now they're seeing hundreds of patients or participants. They're not necessarily patients, participants, as we like to call them, as they go through and get tested. Oh, that's fantastic. Thanks, Vicky. Zach, I'll hand it back over to you.
Yeah, perfect. Thanks, Mike. Just want to set the scene before our next story. Team Rubicon had only launched one domestic medical operation prior to COVID, and that was in response to Hurricane Maria in Puerto Rico in 2017. Domestic medical is a challenging environment due to state regulations. That all changed with disaster declarations across the United States. As we took a look at where our medical providers could have the greatest impact, we naturally look to vulnerable communities. And in doing so, we started to look through partnership with Indian Health Services towards our tribal nations. We started work in Kayenta, Navajo Nation on 8th of April, so 1 month ago today. And during that time have seen just shy of 600 patients. And we've actually expanded clinical support to staffing ambulances to get out to some of the more rural communities. So I'm going to turn it over to Dr. Keegan Bradley here. He's been putting in the hard yards in Navajo Nation. So over to you, Dr. Bradley.
Hey, thanks for including me on this. I just wanted to first give a shout out to the team I had out in North Carolina who helped kind of lay the groundwork for Team Rubicon getting involved with a lot of these drive-through triage systems and testing sites. I know they were one of the first to kind of show that Team Rubicon can be a part and can support medical domestic outreaches like this. They did a great job out here. Made my life easy, made a lot of the staff's life here easy. You could even say a lot of the operations that were conducted out here wouldn't have been possible without Team Rubicon member support. So I wanted to kind of mention them. But Kayenta specifically, after I finished up here, I deployed out there for about 2 weeks, got back literally just a day or two ago. So it was an interesting place. I had never been on a reservation like that per se, but it's definitely an underserved population out there. I don't know how much everyone who's listening or is on this knows about the impact that COVID-19's had on the reservation out there and, you know, across the other locations. The last statistic I saw is it's about a 10 times higher per capita infection rate out on the Navajo Nations compared to the rest of the state. So significant numbers of people. I worked the emergency department myself. We also had some medics deployed and nurses. All were really welcomed by the people who were already there. The medics, some of them were running 24 or longer shifts a day, 36-hour, 48 hours, just purely out of understaffing. We had nurses and techs that were helping us in the emergency department. I know when we were showing up, a lot of their staff had been running every single day just out of purely lack of staff. So they were really happy to have us helping support them. And then myself and another doctor, Dr. Chardoff, were able to deploy out there and help them. Number wise, we weren't seeing a huge number of patients, but a lot of the ones we're seeing are very sick. Significant amount of COVID. And the tough part out there, there's a big part of the nation and that has multiple hospitals, but this one had only an emergency department. Unfortunately, it had 1 or 2 beds upstairs, but when we arrived, we realized if you can't solve it in the emergency department, then you're flying them out. So most places you can get away with that. This place, you had to fly a lot of people out. So unfortunately, a lot of these people, I'm sure if anyone's interacted with a COVID patient, know they don't come in very stable. They're low on their oxygen, their heart rates are very high, and a lot of places will not fly those people unless they're intubated, and it becomes kind of a double-edged sword. Because when you intubate a lot of these COVID people, sometimes it can be very dangerous for them, and sometimes they don't come off the vent, so it becomes a very tough decision. But a lot of these patients were still coming to us. They trusted us, and they knew we were going to do what we could to help them. We had staff in the emergency department even that were getting COVID infections as well. I can't go into too much detail just out of purely patient privacy, but we were having to care and fly out some of the staff who were helping us in the emergency department as well. So it always hits you hard when it's part of your own team in that emergency department that you have to take care of. It really hits home because you know that person, they've been working with you, helping you. The location itself is pretty isolated. It's probably a 3-hour drive anywhere to any other healthcare location to give everyone an idea. Otherwise, it's about an hour or 2 flight. We started even loading up the other outside hospitals. Every time we'd start to call a hospital a week or 2 in, they'd say we're full. So you have to keep moving out and out. So between that, and then the other big part that TR has helped with besides patient care is supplies. They were so desperate to get anything from gowns to masks that TR was able to provide for them, especially from the Santa Clara operation after that toned down. One of the heads of the medical transport unit almost broke down crying when we showed up with the gowns to give them, because he was on, I think, his last gown or 2 for his whole medical crew. So it was a big help to them. They were very, very happy that we're there. And I'm excited to hear we're extending out there for a little bit, but it was definitely an experience to see that many sick people who are that underserved still that happy to have help. And they were really grateful too. They'd cook for us some days. They were just so nice. It was a very unique experience. So if anyone gets the opportunity, it's a great place and a great operation going on out in Kayenta between our instant command, our medical staff in the ED, and our medics in the trucks helping transport people. And the Kayenta inhabitants and the surrounding population are really happy we're out there. We're doing a lot.
Oh, that's great. Thank you, Dr. Bradley. Quick follow-up. Was there a specific time or day that, just for you made it all worth it, that just stood out amongst the rest? I'm sure there's several.
Yeah. So I think the time when the first day I got there and I realized how sick everyone was, but I think the best example was when we had to intubate one of the ED staff, and then to hear before we left that they were coming off the ventilator at one of the outside hospitals, and to know you had helped to save one of your own team who, potentially could have died had it not been for, the Team Rubicon staff and then the Kayenta emergency staff who were there just doing the best they can. Because the other thing I'll say is right now we're having a tough time quarantining people. Unfortunately, they're so socially tight knit. When we see someone who's sick and they're not sick enough to fly out, you unfortunately are sending them right back home to the rest of their family of 10 or 12 that live in the same house. So we're kind of just trying to stem the tide as much as we can.
Once again, thank you. Thank you to the entire team out there. Thanks for working with us in North Carolina on the testing side and for everything you've done. Greatly appreciate it. Look forward to seeing you again.
Yeah, definitely.
I'm going to switch gears now and move to Detroit with Ian Cobbs. A little bit of background on Team Rubicon feeding operations. One of the first service deliveries we switched to as the COVID pandemic spread was feeding services. We partnered with Feeding America and their affiliates across the country to staff food banks, food pantry, and mobile delivery sites, delivering food to vulnerable populations that were forced to isolate and were living paycheck to paycheck. So with that being said, I'm going to turn over to Ian Cobbs now. Ian, over to you, brother.
Yes, sir. I feel my heart race and I need a moment after what I just heard. Just the thought of having 2 gowns left for your entire crew, and then just the simple action of giving a gown would bring someone to tears. I mean, it shows how much everyone needs a lot of stuff right now. Which reminds me, over in Detroit, I mean, like you said, we're passing out the food, and we've had multiple occasions where someone's walking up and it snowed a few days and they're walking in the snow, they don't have a vehicle, and they get to our location and they're just so grateful to receive a meal that they're themselves are in tears. And it just shows that the need is out there. I mean, people, like you said, living paycheck to paycheck. We have situations where you don't have a car, you don't have money to get food, whether there's jobs or not. And I mean, it's great to have Team Rubicon be a part of. We're grouped with World Central Kitchen in the location I'm at, and it's a great partnership there. Um, Out of the 12 gray shirts on my team, 10 of them, this is their first op. I've been told we call those COVID babies, but yeah, they're absolutely killing it, and it amazed me to see just how amazing the new people are to Team Rubicon. I mean, maybe they never saw Team Rubicon before and they never met it, but they decided to sign up and just come out and assist. And we have somebody that was taking an Uber just to get to the job site and to help people. And that, I mean, I don't know if you guys feel like that's very amazing, but personally, like the dedication in that itself is just blows my mind to see that there's somebody willing to help enough that they are paying $20, $40 a day just to travel to a site and help in the locations that we're in. I mean, there's so much to say if I'm being honest. My team, we have somebody that actually had to go back to work, but they still found it in themselves to grab Subway and drive it all the way back to the location just to feed everybody. We have one of my members that they noticed that we had a lot of people that day. They decided to take off and so they could go help Meals on Wheels. I mean, I have an amazing team that I'm blessed to be in charge of, and they've done nothing but pass my expectations every single day.
I got a quick follow-up question for you, Ian. When I was a younger man, I didn't think about service as much as I do now. But you, at a very young age, came into Team Rubicon, and in the last 2 years have like excelled quite well. Obviously, to be pulled on as a task force leader in a time of a national pandemic. So, can you tell us how you found Team Rubicon and what got you inspired to get involved, real quick?
After high school, I joined the Air Force, and I mean, wanting to serve my country as much as I did, I falsified some paperwork to get in when it comes to medical history. So we were talking integrity in the Air Force, and I told my technical sergeant, and I was sent home, and I was in a dark place. The one thing that I thought I was going to be doing, I was no longer doing. And my father was part of Team Rubicon. He said, "Hey, you should sign up. Hey, you should sign up." He kept getting on me about it. I'm like, you know what? You're enjoying this. And he was telling me himself, he felt that he was able to serve and touch more people in Team Rubicon than he was when he was in the Air Force himself. So I finally signed up on Team Rubicon. My first ever thing was a chainsaw op, no, not chainsaw op, I'm sorry, my chainsaw class. And that was when I was 18. And starting like since then, it's just been uphill from there. I mean, you meet amazing people. It's every operation is a family. I've been to 5, been to the hurricane in Florida, tornadoes, floods. It's just you. I mean, we all know how it is. You don't want something to happen, but you want to get out there and get shit done with everybody else.
Thanks for that, Ian.
No, Ian, I appreciate it, and I appreciate you, telling your story. I'll also say that the hyper-competitive individual in me is mustache envy right now. I am really fighting twirling the ends of mine as I look at that. So, full transparency. No, I think that's it for presenters. I want to thank Vicky, Keegan, Corey, Larissa, and Ian for taking time out of their day and jumping on and sharing stories from the field about all the great work our gray shirts are doing across the country. I know we've got a lot of questions in the chat, so we'll switch over to that now, assuming I'm in the right spot, and we'll answer some of those. So, question from Mary. Is full completion of all TR training, such as OSHA, required to participate in Neighbors Helping Neighbors? I'm not officially gray shirt, but I have a request nearby I can help with. Turn that one over to Corey. You want to answer that one, Corey?
Sure. Hey there. We do need you to be a gray shirt to participate in Neighbors Helping Neighbors. And even more explicitly, we need everyone that is putting a gray shirt on to participate in this emergency food assistance to have had a cleared background check as well. This is a new level of engagement and a new level of information that we're collecting from these individuals that are asking for assistance. And so we do need you to have finished that process. Make sure to go ahead and keep pushing forward on that background check. If you haven't, go through TR 101, even though you don't need that to engage, but keep moving towards becoming deployable. And for everyone that is not, take that as a call to action as well.
Awesome. Thank you, Corey. Quick question from Wendy. She wants to know if we can share the EFA link on social media and what's the guidance for getting the word out. So once again, I'll probably turn this one over to Alyssa.
Hi, I'm Larissa.
Larissa. Oh.
But I will take that one on. Yes, everybody is welcome to share our blog and also our website, teamrubiconusa.org/neighbors, and share that across your social media or however you see fit. Yeah, is that the whole question?
Yeah, that's it. And I'll do push-ups after this for
20.
Yeah,
Thanks.
I wholeheartedly apologize. You name the number.
25. I think we have time. We could watch you do them right now. No, I'm just kidding.
Yeah. Ben asks how the Neighbors Helping Neighbors program works. They've been a TR member for years, but never been able to deploy due to civilian work and U.S. AR, U.S. Army Reserve obligations, but would love to volunteer. Watkins, do you want to handle that one?
Yeah, currently the way that Neighbors Helping Neighbors is working is that when you find whether your neighbor down the street needs support getting medical supplies, getting their groceries, they need their lawn mowed, it basically goes through whatever help is needed is just jumping in and helping out and then accounting for it within the system within roll call. It's pretty simple to log in. The information asks you what the type of event was, if it cost any money, and then what was the duration. And then we've been tracking it. And then we have over 3,500 acts of service since it was all started. Some of this will transition into the new program.
All right. Thanks, Mike. Lander asks, any way to volunteer for Kayenta as a licensed EMT in Arizona with medical experience abroad, or do I have to wait for recruitment? Yeah, I'll handle that one. We are extending our operations in Kayenta to at least 10 June. I would imagine that we would continue to extend those services well beyond June 10th as this pandemic continues to unfold and the situation continues to evolve. We're continuously putting out mobilization notifications for medical providers. I will have the team reach out to you since you were brave enough to ask the question and see if we can't get you on that deployment list. Kimber asks, how are plans for additional waves coming along? Any new capabilities in the works for the next COVID peak? Fantastic question. We're continuing to monitor the COVID pandemic. We're looking to best-in-class resources on how this could model out. One of the prevailing models is that it will follow the Spanish flu epidemic of 1918, 1919, and that there's a spring, a peak, a lull during the summer, and then a fall and winter peak, just as devastating as the first. With that being said, there are still a lot of unknowns with this virus. So we're continuing to monitor the situation. We'll rely on the CDC and the World Health Organization guidance on how we address future deployments for any service delivery.
Hey, Zach, can I jump in real quick?
Yeah, absolutely, Corey.
Yeah, I think a couple of other things to think about to kind of frame how we're proactively kind of getting in a posture for the long fight here is we are putting a lot of resources around scaling COVID-19 testing sites. So not only in Los Angeles, but you'll see that in the next couple of weeks throughout the state of California, as well as continued collaboration and anticipated scale with Atrium Health out of North Carolina and potentially into South Carolina and Georgia. And then we've got one other collaborator that we're working with to hopefully scale COVID test sites across the rest of the country. The other thing that is in the play and that's in the works is a water, sanitation, and hygiene capability for our international context. So this is actually getting ready to pilot the moment we've got a discrete opportunity outside of the United States to support folks affected.
Corey, I appreciate the follow-up. Next question was, is it true that because Mike Watkins looks so much like Thanos, that promo code Watkins gets you 50% off in the TR store?
Yeah, I'd like to answer that. That is false. But at the same time, that shit's funny. So if somebody sends me Paul's name, first and last name, I'll send them something in the mail. That's fantastic.
Awesome. I'm not seeing any more questions. Looks like Dale Johnson is typing those, so we'll see what else comes in. If not, we might move to give everybody 15 minutes of their life back. Okay, Wendy asks, where do we get the supplies people needed from Neighbors Helping Neighbors request? We purchased ourselves. How does the process work? Watkins, you want to take first stab at that?
So for the typical, the pre-existing program with Neighbors Helping Neighbors is more along the lines of self-promotion, self-fulfillment, but really to step into the next round of that, I'd hand it over to Corey or Larissa to talk about that program and how that works.
Yeah, Larissa, you want to take that?
Sure. So the folks that are requesting assistance through our new partnership, they will have already pre-ordered their food or gotten financial assistance to order that food. So you as Greyshirt should not be spending your own money. You are literally just coordinating with that person to pick up and deliver their food.
We got, looks like one more question coming in. Here we go. Eric asks, are we seeing any challenges regarding technology and our global readiness with respect to COVID and non-COVID? Hand that over to Zach.
Wow, that's a great question. We're continuing to improve all our tech platforms, EMS in particular, in getting our gray shirts to the ground in response to COVID and just core operations, disaster responses. As we move from the old mobilization system into EMS, it was geared towards getting gray shirts on the ground for hurricanes and large scale events. It was not geared specifically towards moving gray shirts all over the country 24/7 for what I think we were approaching like 90 days now. So, a big, huge hats off to Jonas Reynolds and Brent Slough for helping him and Team Rubicon's entire tech team for helping make EMS improvements over the last few weeks, which is improving getting our gray shirts on the ground. As for other technology challenges, I haven't specifically seen any. I'll turn it over to Corey to provide any other insight on that, and or Mike Watkins. But over to you, Corey.
Yeah, I think in terms of tech, we've got a stellar tech team. We've invested significantly over the last couple of years in our broader enterprise management system solution that includes roll call. Don't anticipate any tech challenges there. If nothing else, we're expanding and growing it, right? Especially with this extension of Neighbors Helping Neighbors, providing emergency food assistance to folks across the country. When we think about other elements of readiness, we're putting plans in place. We're putting an exercise plan in place for a hurricane landfall come this summer. So the organization's already thinking ahead to anticipate how we can be even faster and more nimble with safety precautions in place for COVID-19. And even internationally, we're engaging with organizations like Pan American Health Organization, World Health Organization, to make sure they understand our resource availability to be able to mobilize teams into other countries. Back over to Mike.
The last thing I would just add, and I think it's already been covered a little bit, is just the amount of work and effort that tech team has put in with collaboration across the country, with volunteers, with leaders, the writ large. It has been nonstop and a monumental task. So huge changes, huge adjustments, and huge effort all across the board as far as technology is concerned.
Awesome. Thanks, Mike. Joshua asks, when I first applied to TR, I was told that UAS drone work was not being utilized yet. Has that changed? And are there any needs for data collection, GIS field work from a professional with the industry, especially within the Southeast? So first part of that question on the drones, no, we don't have any plans to utilize drone capability for field work in the near future. Long story short, there are FAA regulations and insurance requirements that we're just not going to pursue at this time. As far as the second piece of question, data collection and GIS field work, we're absolutely. We've got a planning team and right now a visibility and synthesis team, which is doing an incredible amount of data collection and GIS work. Would love to connect you with with Adam Martin, who's heading up our Viz and Synth task force right now. Mike, anything to add on that?
No, I think you hit it. That has everything that I would have said.
Perfect. Looks like we got a few more questions coming in and time to answer them. So let's do this. Arthur asks, what is being done to account for and give credit to enroll call those that are executing remote operations? Mike, you want to handle that first?
Yeah, so I have Leah Wainwright, who works over the Midwest, who's been helping to support some of the remote operations or remote work that we've been doing. We have another few potentials on the horizon as far as ways to get people engaged, up to 5,000 members. It's on the horizon, it's coming forward. But anywhere where we consider that an operation, whether it's remote or in person, we'll get that into EMS. I think some of the 211 support hasn't been classified as an official operation as of right now, but we will work to solve for that to ensure that you're getting credit and it's reflecting in your EMS profile. So again, those are actions that we'll take away from this, but we're aware and we'll get it updated as soon as we can.
All right. I'm not seeing any additional questions coming in. So with that being said, I want to once again thank everybody for jumping on, all the presenters and everybody who logged in for this Greyshirt chat on a Friday afternoon. I have it on good authority that we are going to do a montage of this for TR's new TikTok account, and Mike Watkins next week will be demonstrating the perfect quarantine haircut. Some more to follow. Mike, anything else, and any saved rounds for any of the presenters?
No save rounds for me other than I'll be working on my finger snap kind of going forward, but that's all I got. No, thanks for dialing in. Any other save rounds across the board?
Hey folks, just push it far and wide. We need every single Greyshirt across the country to go to teamrubiconusa.org/neighbors. We need you to take action. We need you to continue to be as selfless as you all are to support those neighbors. So thank you all.
If I may, everything that's been said today, I mean, I appreciate all the work you guys are doing, and you guys are just killing it, and you need to keep killing it. And as it said, I mean, continue to sign up. These are depressing times. I mean, you can't go out. You don't have much you can do. Anyone you can talk to. Can't go hug your grandmother. I mean, but getting out there and assisting others, it lifts you up and it lifts them up even more.
No, thank you, Ian. Appreciate it. Appreciate all the hard work you're putting in up there in Detroit. And Larissa, I'm going to do my push-ups now.
I decided the number is 50.
50. Can't count past 10. It's horrible.
Do 10 5 times. You're good.
Yeah. All right, y'all.
I just want to say it's great to be part of Team Rubicon for our first deployment. You kicked my ass, but it was great.
Thanks, everybody.
Thank you.
Stay safe, guys.